So this is a patient at the hospital in the pre-op area waiting for surgery. And he said to me, "Don't forget me." He was very concerned that I would forget him, and he was very concerned that he didn't want to have his foot amputated because he works and he would not be able to work if his foot was amputated. But it needed to be amputated. It was an open fracture. There was nothing else that we could do. And he's next to a boy who is alone. His family doesn't know where he is, and he also needed to have his foot amputated. So there were a lot of people, several children that we found that were abandoned. We actually found, though, that was interesting that some of these abandoned children were being cared for by other families that were nearby. So we had one that was dropped off. It was almost like Moses in the basket, and she'd had a head injury, and the hospital had put a note on that this patient has a skull fracture. Please take care of her. And when we found her, other families were around and trying to help her and make sure that she had what she needed. So that's an issue as well, as that patients, we have to kind of try to reunite families together. But there was an outpouring even within the Haitian community of helping each other. One little boy I asked me to get him a toothbrush. So I got him the toothbrush. We didn't have toothpaste, and the woman next to him said, "Don't worry about it. I've got toothpaste, and I'll take care of you." You know. But all these patients needed to have amputations. It was all done in regular hospitals with regular anesthesia, with regular care. But the fact is that we had hundreds and hundreds of patients who either lost feet, they lost arms, and they're going to need aftercare. They're going to need prosthesis, they're going to need crutches, they're going to need physical therapy. So even though the surgeries are all finished, in our hospital at least, we're winding down. The aftercare is starting, and we need help with that. Family, this young boy was transported to the United States. He has a depressed skull fracture, which is pretty easily seen here, but it turns out he had a skull fracture on the other side as well. And he was transported to the United States, the University of Michigan, to have definitive surgery done. And this is his family who was here with him. And when we were with them at the military base, the military was just overwhelmingly supportive in giving us supplies for them. So this is a patient here this is a cervical spine, and if you can see, this bone here belongs back here. Okay, so she's got a cervical spine fracture. At this moment in time, she's breathing on her own, she's moving all of her extremities. However, she's this close from being paralyzed and unable to breathe on her own. So this is one patient who went to the Miami Field Hospital and to have neurosurgery done, and they felt confident that they would be able, this is a patient they felt confident with surgery would absolutely be fine. Without surgery, she would die because she would not be able to breathe on her own, she would not be able to move her extremities, she'd be paralyzed. Here you can see this is a right arm, and it's clearly been amputated. Okay. This is a patient here with with a right leg that's been amputated. It's the same patient. So this patient has lost both his right arm and his right leg. And he's going to be living in Haiti. That's, I think, just unbelievable. Like in this country, imagine. But that I think, drives the message home.